I'm a family physician. I had a patient who was very depressed. I don't think he realized it because he was having a lot of somatization. He kept coming in with a lot of physical complaints and a lot of anxiety and insomnia. And he kind of escalated, got in a crisis, and was referred over to the mental health hospital. And I think that the experience was traumatic for him. He was released, and we had contact with him, but he didn't do well, and he committed suicide. There's nobody who was at fault. I mean, the clinicians at the hospital did all they could, and I think we did all we could.
With health and well-being, it's important to understand that mental and emotional health is part of overall health. A healthy person is one with a healthy body and a healthy mind. You cannot have one without the other.
Well, I was in a really bad car accident to where I had brain hemorrhaging and a memory loss. I didn't recognize my kids for 3 months. I suffered from really bad migraines and to a point where I couldn't walk, I couldn't get out of bed. It was just really bad. And the doctors that I were seeing at the time, they just wanted to put me on pain medications, and there was no hope. They just couldn't tell me. They told me it was all in my head.
We know physical health impacts behavioral health, and that behavioral health impacts physical health. Yet the healthcare system has historically treated the mind and body separately. This separation is costly, frustrating, and doesn't lead to the best outcomes for individuals or families.
I didn't expect that my doctor would be the person that I would open up to and break my isolation. After we do all of my vitals, he comes in and he sits down with his computer and he says, okay, where are we going next?
Most people seek help for anxiety, depression, attention deficit disorder, and more mental health conditions in the primary care setting. And more than 50% of primary care visits are related to psychosocial concerns.
I have been working in integrated care for probably about 6-7 years. One specific provider and I have been working to tweak the co-visits. One patient that I've really seen this work with is in cognitive decline. The provider and I were able to say medication isn't going to do anything, and that united front really helped that family understand. You see that they're finally getting it. You realize that mom's care is going to get better. It's going to improve.
Integrated care combines medical and behavioral health services, which helps people feel they've come to the right place.